everybody. Today I want to talk a little bit about scoliosis and what a scoliosis is and why chiropractic care is so helpful in treating a scoliosis. Most of my patients that come in with a scoliosis are younger, but I do have many patients who have had scoliosis for their whole lives, and I see them older and later in life as well. So when we look at what a spine looks like, the spine from front to back should be pretty straight. We should see the head level, the shoulders, which come right about here, should be nice and even, and your hip bones should be nice and even or level too, okay? So even though my spine is looking a little crooked, ideally your spine should be nice and straight and level. When we look at a spine to a side, the side, normally, what we should see is you should have curves looking this way. So there should be a backwards curve in the neck, a little outward curve, what we call a kyphosis in the middle back, and then what we call a little lumbar lordosis in the lower back. Now, when we look at what a scoliosis spine looks like, what we usually see is a lateral curve to the spine. Sometimes we have two. There's one in the top, and there can be an opposite one in the bottom. That's called a double major scoliosis. But a lateral curvature of the spine is what we call a scoliosis spine. And scoliosis is very treatable with chiropractic care. Many of my patients that come in with a scoliosis have pain, have muscle spasms, have abnormal hip alignment, or the joints are real locked up and stuck. In chiropractic, we call those subluxations. That's what we adjust. We find those areas of the spine that are locked up and stuck and not moving, relax some of the musculature, and then with stretches and exercises, we can help to support a scoliosis so it isn't as painful and stressful on the body. Sometimes scoliosis, we've been able to see them actually reduce some of the curvatures. So anything that's over 20, 25 degrees gets into the zone of where we need some sort of potential bracing with an orthopedic. Anything that's over like 35 degrees gets into where we need to discuss possible surgery. Anything under that, which is the majority of people who have scoliosis, something like 90% of scoliosises are under 20 degrees, under 25 degrees are very workable, very treatable cases with chiropractic. So if you struggle with the scoliosis, if you have pain, if you know that you have an imbalance in your spine due to a screening, or maybe you need to have x-rays taken so that we can measure exactly what degrees your scoliosis is and then discuss treatment options, because chiropractic is excellent to help treat people with scoliosis. Okay, I hope that helps. I look forward to seeing you real soon.